We are now going to demonstrate the squatting exercise. Squatting is a closed kinetic chain exercise, meaning it's performed in weight bearing. As with any weight bearing exercise, you want to have caution and always look for good alignment and technique while performing the exercise with the device on the leg. These exercises can be progressed in difficulty based on the patient's confidence and their ability to perform the exercise safely and correctly. The level 1 squatting exercise is an isometric hold in a shallow squat position. The patient starts seated at the edge of a mat or a sturdy chair, with the feet placed about shoulder width apart. When the contraction of the device is felt to come on, the patient leans forward at the trunk and presses up to hold in a shallow squat position, with balanced positions between the knee and the hip joints. When the contraction of the device releases, the patient lowers back down to sit on the bench or the chair to rest. These motions are continued with the contraction timing of the device, performing an isometric hold at a comfortable angle of knee bend during the contraction, and then sitting back down to rest when the contraction is off. As with any weight-bearing exercise such as squatting or stepping, ideal alignment is important for keeping the joint happy and healthy. The patient should avoid allowing the knees to push forward beyond the toes while performing the squat with an upright trunk position. Instead, the patient should have an even amount of bend between the hip and the knee joints. To achieve this, there must be a bit of a forward lean at the trunk with a straight, strong back. With squatting, the alignment in the front view is critical for keeping the patellofemoral joint healthy. When performing a good squat, the patient shifts into the squat position with the kneecaps well aligned over top of the second toe of each foot. The body weight is centered with the trunk in an even position between the limbs. The patient should avoid allowing the thighs to collapse inward, which places abnormal forces on the knee joint. They should also avoid weight shifting off of one limb or the other. The patient may use a bathroom scale under each foot to help them identify what even weight bearing is with a two-legged squat exercise. For patients who don't yet tolerate closed kinetic chain strengthening or have some sort of an injury or a surgical precaution, they may begin body weight reduced closed kinetic chain activities through the use of a leg press machine or an exercise ball at home. To use an exercise ball at home, the patient would wedge the exercise ball in the corner so it did not roll from side to side. The patient will then lie on their back with their heel resting on the ball with the knee in a slightly bent position. When the contraction of the device comes on, the patient presses the knee straight, pressing into the resistance of the ball and holding the contraction for the entire on cycle. When the Kneehab contraction releases, the patient relaxes and allows the knee to go back into the slightly bent position. Repetitions are performed in this fashion with the on-off cycle of the Kneehab program. The level 2 exercise with squatting is a press-up from a seated position. Again, the patient starts with the feet shoulder width apart. When the contraction from the device is felt to come on, the patient weight shifts forward so that the feet are planted firmly on the ground and slowly presses up through the rising motion of a squat to arrive in standing, continuing to squeeze the quadricep muscle tight until the contraction releases on the device. Then the patient sits back down to the surface to rest. When the device contraction comes on again, the patient leans forward, firmly planting the feet and pressing slowly up the squat motion with the contraction timing of the device. When the device releases, the patient returns to the seated position to rest. To progress the squatting exercise to levels 3 and level 4, The patient or therapist may decide between several different intensity modifiers based on the patient's knee comfort and their competence with a given exercise. The squatting isometric hold or the press-up may be performed from a deeper starting position by having the patient start on a lower surface. If a deeper squat is not well tolerated by the patient's knee, they may consider staying at a shallower squat depth and increasing the amount of external resistance by either using hand weights, a resistance band, or gradually shifting more weight onto the limb that is using the Kneehab device. The patient can gradually progress from doing two-legged squatting to one-legged squatting by performing a single leg squat with tip-toe support from the opposite limb, and then gradually progressing to one-legged squatting. With any squatting exercise, if balance support is needed for safety, please do so.